of a program, but the beginning of new dreams being shaped, new journeys being prepared, and a lifelong callings being affirmed. Medicine is more than a profession, and it is also a mission. So as you take steps towards residency, you are preparing to enter a period of training that demands sacrifice, perseverance, compassion, and resilience. Gadol exists to support you through this journey. And we are around to be your advocate, your network, your family. A residency is often a time filled with long hours, difficult decisions, and personal growth. It is our desire that through today's session and beyond, you find hope, courage, and clear direction as you prepare to serve humanity through your chosen specialties. You'll hear today about the real experiences, the workload, the sacrifices, the expectations, and also the great rewards. Listen carefully, ask questions, and connect. For in these conversations, you find wisdom and strength you need for the path ahead. And not to sound spiritual, I'd like to take a verse from Proverbs 24, verse 5. And it says that the wise prevail through great power, and those who have knowledge master their strength. Today, you are taking a bold step towards wisdom, strength, and excellence. May this program be your source of clarity, inspiration, and bold determination to move forward with purpose. So once again, on behalf of Gadol, I'd like to say a big welcome. And we are proud of you, we believe in you, and we stand with you. Thank you, and God bless you all.
God bless you too, Dr. Idu Ntiamwa. I mean, that was insightful. We are aware that we have Gadol, and medicine is not just a mission. They are here to advise us. They are here to help us build a network, and they are our family. For every medic, I mean, it's a very long journey through medical school, and the next big, task is house job, and then after house job, it brings us here. What's next? How do we specialize? And so I'm very thrilled to get into this session where we're going to have real conversations. We're going to talk about the nitty-gritties. They're very important things. And so I'll be introducing our speakers shortly. Each of our speakers are going to have 7 minutes to share a few insights with us. And after their presentations, we're going to have them answer a few questions, burning questions that we've had. So I just want to encourage everybody to not hold back. Whatever has been bothering you, whatever your frustrations have been, be ready to share them, and I'm sure there'll be answers for you. All right, so we're getting right into it. The very first presentation we're going to have, or our very first speaker, is going to talk to us about family medicine. She is a resident at the Kolebu Teaching Hospital, and she's here to talk about all we need to know when it comes to residency and family medicine. So help me welcome Dr. Ajwa Beecham. Let's welcome her. Dr. Beecham, please take over.
Hello, everyone. I'd like to say a very good evening to you all, and also thank the Gadol executives for this opportunity. I mean, for giving family medicine a slot to also rep ourselves here. And as she mentioned, I am Ajwa Nyankwa Beecham, a family medicine resident at Kolebu Teaching Hospital. Please, can you see my slides? Can my slides be seen?
Please, we can see.
Okay, all right, sure. Okay. All right, so we are talking about the roadmap to family medicine residency, and this is going to be the outline of my presentation. A brief introduction about what family medicine is. We'll talk briefly about the primary exam for Ghana College and West Africa primary exams. There are various institutions you can train as a family physician and the journey so far. So forgive me for the fonts, but family medicine is actually a specialty that focuses on providing continuing care continuing coordinated healthcare for all patients of all sexes, regardless of their age or the kind of illness that they have. Okay, our focus is more on the context of the family, the environment, and then the culture and community the person finds himself. So we base our theory and everything we do on the general systems theory, which states that diseases are not only caused by biological agents, but by influences from the family, from the community, from the environment. So we don't only see an individual as having a disease. We go beyond the biological condition the person has to bring a holistic, care to the individual. All right. So in the UK, we are known as the GPs, the general practitioners. In the US, we are known as the family physicians and all that. In Ghana, we are also known as the family physicians, okay? And we handle the primary care facilities. So when you come to the polyclinics and in the districts, we are the ones there, all right? And you'd want to ask me why I chose family medicine. I chose family medicine because, I love bits and pieces of everything. I love bits and pieces of surgery, ONG, internal medicine, psychiatry, and all that. And if you are someone who doesn't want to let go of these skills, I welcome you to family medicine, all right? So we do basically everything. We do surgeries, we do minor surgeries, we do deliveries and all that. So we do bits and pieces of, bits of pediatrics, we do psychiatry, we do ONG, we do surgery, internal medicine, whatever you can think about. Now, let me briefly talk about the family medicine primary exams, okay? So we have two colleges that train us. We have the Ghana College of Physicians and Surgeons, and then we have the West Africa College of Physicians and Surgeons, and we fall under the physicians, okay? So if you're looking for advertisements or posters on when to write the primaries, look out for under the physicians column. Don't look under the surgeons column, okay? And the exams are written twice a year. We have the first batch taking place for West Africa in February, and then Ghana College in March. And then for the second part, the West Africa takes place in August, and then Ghana College in September or August. So you always have to look out for the flyers and then do due diligence, okay? All right, so talk of the Ghana College primary exams. What you see here as the scope of the exam is what you actually have to pay attention to. So the bulk of the exam is based on what I am sharing with you now. So 5% of all the questions, okay, for family medicine primaries is from intro to family medicine. We have certain tools that are peculiar to us as family physicians. So, you can reach out to me or any family physician, when you feel like you want to write family medicine primaries, and would help you. And then 10% of the questions goes into applied anatomy. 10% also goes into applied physiology. We have 10% going into applied biochemistry. 10% again goes into gross pathology. 10% goes into clinical pharmacology, 5% into genetics. Community medicine forms 10% of it. Applied statistical methods also forms 5% of it. And then human behavior and psychology takes 10% of it. So if you really want to pass the primary exams, you should go back to your basic sciences. And I kid you not, everything I've mentioned here, forms a part of the exam structure. All right. And this is for Ghana College, and for West Africa primaries, they usually have update courses they have before the exam. So they usually don't have any structured form for the exam. But if you really want to pass the exam, you have to pay attention to the topics they treated during the update courses. So you can't write West Africa exams for family medicine without looking at the update, going through the topics or tutorials for the update course, okay? Right. And there is a Telegram group page that is made up mainly of Nigerians, and they are focusing on West Africa for family medicine and also their nationals, as in their Ghana College in quotes, like Ghana College, as in their Nigerian college primary exams. So they help us a lot in preparing for the West African exams. And I must say that it's easier passing the West Africa exams than passing the Ghana College. I don't know why, but it seems to be the song every resident sings after going through both exams, that it's easier passing West Africa than passing Ghana College. Okay. And also yeah, so that is it. So if you want to start the primaries, after you've written the primaries and say you passed West Africa and then you also passed Ghana College, the only time you can start your family medicine residency is in September, whether you are using Ghana College or West Africa. Gone were the days where you could write West Africa primaries, pass, and you could start your residency training at any point. You could start, say, in January, February, whenever you think you are ready. But now things have changed. It's no longer like that. So if you want to start your West Africa training in family medicine, you would always have to start in September. They want us to be one cohort with the Ghana College residents. Okay, so you'd want to ask, is it even necessary for me to write both Ghana College exams and then West Africa exams? Is it even worth it? So my simple advice here is that if it depends on when you want to write the primaries. If you want to write only West Africa and still start the program being a Ghana College resident in addition to your already West Africa resident, then you'd have to write your exams early, say in February. If you write your exams in February and you pass, for West Africa, it takes a while for them to give you your pass certificate. Now, once you've gotten your pass certificate for West Africa, you can apply for the interview for family physicians in May organized by the Ghana College of Physicians and Surgeons. So once you have your primary pass certificate from West Africa and you go through the interview you can use it as a waiver to enter Ghana College residency without necessarily writing Ghana College exams. I hope it's clear. But if you decide to write your primaries for West Africa in August, the pass certificate delays. So within a period of 1 month, you may not get your certificate to be able to start with the Ghana College people in September. You'd have to start the following year. So if you really have more time on your side, you can choose to write anytime, then wait and start with Ghana College the following year. But if you really want to start same year with both Ghana College and West Africa, you have to write it early in February, get your pass certificate from West Africa, use it to apply for the interview in May. Once you go through the interview and you qualify, in September, you start your residency as both a Ghana College resident and then a West Africa resident. Okay. Yeah, if you have any questions, you can ask later. So for family medicine, we have the modular system and then the regular system. So the regular system is 3 years, what we all know. And then we have an option for the modular program. And the modular program is mainly for those who are in the districts, those who are med soups and all that, who can't really leave their facilities to come on ground for training for 3 years. So the modular program spans a period of 4 years as compared to the regular, which is like, 3 years. So if you want to consider the modular program too, it's also fine. So which institutions train us for both West Africa and Ghana College for family medicine? So the training institutions for regular students in Greater Accra, we have Kolebu Teaching Hospital, we have Nyaho, we have Ridge Hospital. In Ashanti region, we have Komfanochi Teaching Hospital, and then in Central Western, we have Cape Coast Teaching Hospital. Okay, then these are the training institutions for the modular program. So if you want to if you want to do the modular program, these will be your training institutions. We have various belts we use. So for the Greater Accra belt, you can train at Kolebu Teaching Hospital or Ridge. If you are within the Central Region, Western Region belt, you train at UCC or Cape Coast Teaching Hospital. If you find yourself in the middle belt, Ashanti region, you do Konfanochi Teaching Hospital. And if you find yourself in Sunyani, I'm told the training is done in Sunyani Teaching Hospital. Okay. So how has the journey been so far? I would say it is what you make it. Residency is adult education. Nobody will sit you down to tell you do A, B, and C. So you journey based on your goals, your aspirations, your dream, and all that. You start when you are ready. You write your exams when you are ready. No pressure on anyone. But it is important to mention that you should be prayerful, because if you're a spiritual person, you know prayers, you cannot do away with prayers. Be diligent, be commitment in your training, because it's not easy. For us family physicians, we have something we call fallback. So as I'm doing my rotation, so throughout your journey, you go for rotations. You do 8 weeks of pediatrics, 8 weeks of general surgery, 6 weeks of obstetrics and gynae, 6 weeks of internal medicine. And even as you are away for your training, once every week, you come back to the family medicine department at the polyclinic to practice your family medicine tools. And every week too, you do 1 night shift. So you should really plan yourself very well. Otherwise, you get confused and lost in the system. Okay, so prayers, diligence, commitment, practice, and then teamwork. So what are some of the specialties that, you can specialize into, when you do the family medicine program? So you can enter into geriatrics. You can also go into sports medicine. Now, a lot of our guys are going into sports medicine. About 70% of the males training for family medicine have dreams of becoming wants to go into sports medicine. So you can also become a palliative caregiver. You can also choose become a generalist family specialist or family physician. Okay. And at this point, I think I will end here. If there are questions, we'll take it later. Thank you very much.
Thank you so very much. Thank you so very much. That was very insightful. All about family medicine. I hope we're taking notes. We want to move right on to our next speaker. And we're going to talk about ophthalmology. So we'd like to welcome Dr. Nehemiah Hammond, who is a third-year resident at Kolebu Teaching Hospital, to give us all the information we need about preparing towards our residency in ophthalmology. Okay, Dr. Hammond, the floor is yours.
Thank you very much, Nathan. Good evening to all of you. I trust we are all doing well. So I think I'm the first person from the Faculty of Surgery talking, because ophthalmology is under the Faculty of Surgery. And it's a very interesting program, which I feel like a lot of people don't know much about it, because from medical school, we spend, 3 to 4 weeks, and we are not properly exposed to the nitty-gritties of ophthalmology. And so afterwards, it's not even a specialty to consider. But I'd like to invite all of you to really consider ophthalmology, because it's quite an interesting specialty, and there's so much excitement ahead of us, because we are not so many, even though the numbers are growing, and so there's more room for a lot of people to come and join us to increase the number of ophthalmologists in the country. I'll give more general tips about residency and then focus on what happens in our department. So it's not a cakewalk. Residency is very difficult. That's the truth. But you take consolation in the fact that a lot of your predecessors have gone through, and so you can go through. And that is one advice that really helped me all the way from my primaries to practicing now. So just know that we are all here to help you. Once you decide that you want to write the primaries in ophthalmology and you get in touch, there is so much help that you can get, both online and in person. And so please feel free to reach out. once you are interested in doing ophthalmology, and you'll be just overwhelmed by the support you get. So like like the first week I said, we have both Ghana College and West Africa College, and there really isn't much difference in the training, but it says that you write 2 exams at the end, and there are just subtle differences. So say for West Africa, for one of our external rotations, maybe if you do 1 month for Ghana College, for West Africa College, you do 2 months. But otherwise they are the same. So in first year, you because it's a new specialty and you really don't have much knowledge, the learning curve is quite steep. And so you have to be very determined that this is what you're going to do and then fight through it. So first year, you are now getting your skills. You'll be in the primary care clinic where you see the new cases most of the time. And then once you see any case, you have to discuss with your seniors. That is the only way that you can pick up information. To always discuss cases. And then in second year, that is when you start entering the subspecialty clinics. So we have glaucoma, we have retina, we have pediatric ophthalmology, we have neuro-ophthalmology, and we have anterior segments, and then oculoplastics. So second year, you start entering part of first year, you start entering the subspecialty clinics. And then second year, you go for your external rotations so we do both internal, like inside your training facility for Kolibu. So we do inside Kolibu and then we do outside Kolibu as well. So for inside Kolibu, you rotate through neurology, neurosurgery, and then ENT, ear, nose, and throat, since they have a lot to do with the eye. And then you go on external rotations. So you go for surgical rotations externally, you go for clinical rotations where you learn to build your skill. And then in third year, you come back to the clinic, finish your rotations, and then get ready for exams. Optics and refraction is part of ophthalmology. So usually in second year, we have a membership part 1 exam that we write at the end of second year. And for Ghana College, this is a requirement. You have to pass this exam before being allowed to write the final exam. That's after third year. But for West Africa College, you write the optics and refraction in the same week as you write your medical and surgical exam. So that's another difference to note. The clinic schedule, it's like normal clinic. You have to get there early and then just start seeing your cases. And as I said, discuss with your seniors. And you have to apply yourselves. You don't have to just dilly-dally around and think that the information will come to you. Because it's a surgical discipline, it's an apprenticeship. And so the only way to learn is to do. Just like you are driving a car, you can watch videos on how to drive a car, you can get lectures. But if you actually don't enter the car and start driving and making the mistakes, you never know how to drive. And so you have to get involved and try and be as hands-on as possible, because that's the only way you pick up the skills, especially if you are from outside facility coming in. You have to be very confident by the time you are done with third year, so that when you go back to your facility, you'll be better prepared to handle any case that will come at you. And then, you start after maybe like 6 months in first year, you start doing duties. And so during the duties too, you get to pick up more skills, you get to pick up more knowledge. And so duty is something that you should always embrace, even though the times are stressful and the days might be long. Those are the times where you learn a lot. And so always embrace duties. I'd like to end here by saying that it is very possible, not to quote Baumia, but it's very possible to be an excellent ophthalmologist. The training centers are Kolebu here and then Konfanoche. So you are all welcome, and I'm sure that during the question and answer session, things that I didn't talk about, you can bring them up and then we'll discuss it. Thank you and have a wonderful evening.
Thank you so much, Dr. Hammond. That was also very well I mean, I think you went in and explained a few things for those of us who are looking to do ophthalmology. You said there's a lot of room. There's a lot of room. So if you are interested, please don't run away. Okay. They need more hands for the eyes. All right. And I'm told we are live on YouTube as well. So all of you on YouTube that are following, yes, we are observing and we are also taking notes of your questions. So once we get there, we'll explore them. Right. So moving on. I know that this particular field, there are people that run away from it and people that run towards it for different reasons. Next, we want to talk about residency in psychiatry. And so to lead the sport in that, we want to welcome Dr. Kwesi Ainchi Koranting, who is a resident at the Faculty of Psychiatry at the Ghana College of Physicians and Surgeons. And so, Dr. Koranting, please, the floor is yours.
Okay, thank you, Netta. Good evening to everyone. So I'll be talking about the pathway to residency in psychiatry. And like Netta mentioned, we are the people you all look at and ask why psychiatry? And I take pride in the fact that when everybody is lost, they call us to come and then give them answers. People tend to feel, or people run away, like you mentioned, because of prejudice, stigma, the feeling that they'll be harmed, the feeling that you are not going to understand your client. But I'll try to demystify it for you, and then for others who are considering the program. To begin with, we are currently classified as a deprived area in this country, and therefore, right after house job, you are permitted to write the primaries and then enter the program straight away. So you don't have to wait for an extra year or the stipulated 3 years as it used to be. You can, right after your house job, get into the program. An estimated 13% of our population live with some mental disorder or psychosocial disability. And if it's 13% and we are using, for a long time, we've been using 30 million. So if we are doing that, that's an estimated 3.9 million people who have some form of mental disorder. Currently, including our bosses, and I'm talking about with those of us training and our bosses, we sit at a comfortable number of about 150. If you are going to use that figure with the number of the estimated number as a ratio, that is one practitioner will be taking up, care of approximately about 26 to 27,000 people. And that means that is not, the burden is a lot. And we need more people to join us. And then, so we do take care of these people. The last 5 years, we've seen an increase in the numbers, and it's been exciting. So far, I think if you are to take stock of residents in psychiatry, it would be close to about 70. And that's more close to, close to 60, yes. And that's quite a huge improvement over the years. This year we've seen 14 residents. In fact, all those we presented for the West Africa exams passed, 14 of them. And that's the highest number. For the first time, Ghana has been recognized as a center for writing the West Africa exam. And we saw the first batch of people, 14 of us presented, and everyone passed. It was 100% pass. So yes, we are doing something right, but we need a lot of people to join us. So the program is run by the Ghana College and then the West Africa College. And like Adjoa mentioned, the exam is written in February, March. I think February for West Africa, March for Ghana College. And then August for West Africa, September, October for Ghana College. Just be on the lookout for the posters from either colleges, and then follow the prompt. Go to in fact, before that, I think everybody should sort of go through the college websites, see what the requirements are, prepare for the primaries. I'll talk about the primaries shortly, but then see what the requirements are, get your signatures, your recommendation letters, whatever would be needed, and then now concentrate on the exam. For psychiatry, the exam is basically basic sciences, research methods, neuropsychiatry, neuroanatomy, neurophysiology. You do the history of psychiatry in Ghana, the Mental Health Act. You'd have to, yes, and these are things you would easily get from your predecessors. Just approach anyone in the program. There's a folder, it will be given to you. If you need help, you'd get all the help. In fact, there are study groups that go on over the period. But if not, you can approach anybody. We can take you through what you need to know for the exam. It's not too difficult. And I can talk for Ghana College. I'm not doing the West Africa, but for my colleagues in West Africa, there's an update course. They take that update course, especially in neuroanatomy and the basic sciences, and then they write. Unlike in family medicine, most people feel the West Africa is much more difficult than the Ghana College exam. There's also a waiver with regards to West Africa. So you can actually pass, once you pass your Ghana College primaries, you can actually use the result and then apply for the waiver for the West Africa College. And I think you pay, currently, I think the fee for the waiver is $1,000. So you pay $1,000, then you're admitted into the West Africa College. The program runs for 2 years in the West Africa College and for 3 years in the Ghana College. So the only advantage so far, because the course content is basically the same. The advantage is that you become a specialist about 6 months before you become a specialist with the Ghana College. And so for most people who are doing the West Africa, they encourage us to join them because there'll be some back pay because they'll be upgraded. But I think the paths are different for everyone. So if you know what you want to do, you stick to it and then you do what you think works for you. Even there are people who just completed who feel it's not necessary to stress yourself that much. You know how we are so concerned about mental health of people. So if you know what works for you, you just do it and then do it comfortably. The program is actually run in Kolebu Teaching Hospital, Komfo-Anokye Teaching Hospital, Ho Teaching. For Ho, you can do the first year in Ho for now, because they just began the program in Trafalgar, Ho. And after your first year, you would be required to come to Kolebu to do your second year rotation, because in second year, you are doing rotations in psychology, neurosurgery, neuropsychiatry, radiology. So because of these facilities, most of us, in fact, second year, I think almost everybody comes to Kolebu. If you are in Komfo-Anokye, you would be in Komfo-Anokye because they also have the facilities to handle the various rotations. For now, you come to Kolebu, and then I think you go back in your final year to complete. Or maybe you come to Accra Psychiatric, I don't know. And then the other training facilities are Accra Psychiatric Hospital and then Pantine Psychiatric Hospital. For Tamale Teaching Hospital, I think for now, they allow you to go and do your child, if you want to do your child and adolescent mental health rotation in Tamale and then come back. I did mine in Konfanoche, even though I am in Kolebu at the moment. So yes, there's that freedom of moving around if you want a certain new experience away from Kolebu or away from Accra. So the course content is quite voluminous. You would have to read. And there's a lot of reading that has to be done. At our orientation, we are told, and I think it's for every program, 80% of the job is done by you. Very few times there are didactic lectures on Zoom or Meet or whatever, but there's a lot of help during the program. During the psychiatry program. There are fora that are organized for residents, for case presentations and discussions. At least every week, we know on Thursday, for example, that you have a case presentation with comments from your bosses who will be logged online together with you to direct you and to guide you. So there's help during the program, a lot of help. You can approach anybody. You can get any predecessor to help you organize your thought. The thing with psychiatry is you have to be prepared to have an eye for detail and to listen, because unlike other programs, let me stick to that, where you quickly gloss over detail, we do not, because we are fishing out for what the others are not seeing. So you have to be detailed. I've had to sit down with a family for 4.5 hours to arrive at a diagnosis. That is how patient you have to be able to make sense of what is going on. So you should be prepared to take your time with your client and to understand what is going on. But then again, it is also knowledge-based. Your eye will never see what your brain doesn't know. So you should know what is in front of you because you have read it somewhere, or you have actually discussed the case with the boss and you now can pinpoint that this looks like something I've discussed with this boss, and you'd be able to help your client. So knowledge then becomes the base or the foundation on which you build on. So there's a lot of reading to be done. And because there are neuropsychiatric manifestations in almost every department, that's why we also do liaison medicine in second year. And liaison medicine is where, liaison psychiatry is where you go, in fact, you become like the resident on call for every department. They call you to the ER, they call you to surgery, they call you to ICU, because psychiatry, mental health is everywhere. So your knowledge base from your medicine, your surgery, your ONG should also come to play. So unlike the notion that, it's just psychiatry, that's false, because you should know what lupus looks like to be able to diagnose lupus psychosis. You should know what HIV looks like to be able to say that this is HIV psychosis. There are people I've met and UTI presented like dementia. So you treat the UTI, everything goes. So your medicine base should be good. Prof. Henry mentions how that he was called to see a case. And when he saw the man, the first thing he noticed was the gingival hyperplasia. And he knew right from pharmacology that was a side effect of phenytoin. The man was brought to the ER because he had actually, in his sleep, mutilated himself. And the surgeons had fixed it, but they found it strange that this guy would come and say that the man had a seizure disorder. All was because he observed the hyperplasia and knew from his pharmacology that was a side effect of phenytoin, and therefore this was a seizure disorder patient. And what had happened was that he had a seizure and then he cut himself. In fact, he cut his manhood off, and that was the case. So your medicine should actually be good to be able to do all of that. The journey would require, in fact, we are one of the most family-friendly residency programs. We have one of them. You may not have to be it's not as rigorous as the others. It's quite flexible. It's quite we understand that people need to rest and all of that. So it's quite flexible relatively if you look and compare to the others. You don't need to worry about holidays and missing holidays and all of that, because we actually factor them in the planning of your schedule and all of that. So if you really want to enjoy your holidays and your weekends, well, first year you may have to do a few weekend duty, but second year and subsequently final year, I think you would enjoy it. So kindly come, we need you, all that cohort, we need you to join us if you really want to enjoy your holidays. So yeah, I think I would end here. If there are any questions, we'll take them later on. Thank you very much for your audience.
Thank you very much, Dr. Krante. That was really insightful. I can see that there's serious marketing for psychiatry. So please, if you are interested in psychiatry, they need you. Do not run away. Do not be fearful. We want to quickly run to our next speaker. And next we'll be looking at oncology and radiation therapy. Oncology and radiation therapy. And to lead the discussion, we have Dr. Mariah Connie, who is a resident at the Oncology and Radiation Therapy Unit. And so we want to welcome Dr. Mariah Connie. Please, the floor is yours. Dr. Connie, are you on? Okay, so while we wait for Dr. Connie to take over, we would move right to the next one. We'll jump ahead to emergency medicine. I have noticed that emergency medicine is becoming a very commonplace for a lot of people are becoming very interested in emergency medicine. And so we want to listen to the residency pathway for emergency medicine. To lead us is Dr. Eugene Kujo Adomako. And so Dr. Adomako, please, you can go ahead.
Hi, thank you very much, Nita. Good evening to everyone. Just as mentioned, my name is Eugene Adomako. So emergency medicine, relatively new, just as was said earlier, a relatively new specialty. I think it's becoming much more, it's gaining its grounds because it was recently introduced in Accra some 2 years ago. We had a very first batch of specialists graduating from the Accra program just this March. So there are two programs, one in Konfanoche or one in Kumasi. So now we have emergency medicine Kumasi and emergency medicine Accra. That's what it mostly is. So for Kumasi, it's mostly Konfanoche Teaching Hospital. And then for Accra, currently we have Kulibu Teaching Hospital and University of Ghana Medical Center. So that's emergency medicine Accra. So first, with registering for the residency and the interview process, typically follows the same pathway just has been spoken by the previous speakers. We have, so the college website has mostly all the fine details about when to register. Typically, these are opened in two windows. So you'd have to write the primary exam, and there are two windows for that. One window is because we are past, one window is usually in March, and the other one is September. So some few months you get some information on that. Sometimes the September one is extended to October. Yes, mostly so. And then the primaries, what's usually the primary and for the registration and what you need and the eligibility. Currently, yes, it's also one of the new specialties or underserved areas. So you can actually also enter emergency medicine right from house job if you have the interest. The program spans a 5-year period. So a 3-year membership, 2-year fellowship. program in total. But you will need to have passed the membership exam to be able to continue with that 2 years, 2 to 3 years actually, depending on the subspecialty that you decide to choose. Contrary to most people thinking emergency medicine is just stuck in the emergency, there are a whole lot of subspecialties. In Ghana currently, we have critical care medicine as one of them. We have general emergency medicine as one of them. And then also pediatric emergency medicine has just been introduced, where if you did emergency medicine, you can do 2 years extra to become a pediatric emergency physician, or when you do pediatric, you can do 3 years to become a pediatric emergency physician. And I think soon, ultrasound fellowship would be introduced. I think it's still something that the college is still discussing. Yeah, so apart from that, the primary exam typically spans areas like introduction to emergency medicine. So a few things in the emergency medicine where you find almost everything that you need for that particular part of the exam in the Oxford Handbook of Emergency Medicine. I find it very helpful in preparation towards the emergency medicine primaries. And then it also spans some applied anatomy, physiology, pharmacology, and there's some biostatistics occasionally, coming in here and there, and some occupational health stuff generally. So this is what the primary exam typically spans. For the structure of the program, yes, like I mentioned, it's a 5-year program now. There are still some residents currently who are doing the 3-year program. That's the final year residents are mostly doing the 3-year program. The second year and the first year residents are doing the 5-year program, 3 years membership, which is required for you to pass the exam to enter into the fellowship program. During the program, what happens is that we actually have we typically will have some rotation. So the rotation starts right from the first year. So you have like the first year, you have the first few months in the emergency to get acclimatized with what happens in the emergency. Right from the first year, we have external rotations. So external rotations include anesthesia, and with anesthesia department, we do both anesthesia and then we do the IC, intensive care units rotation. And then also we have radiology, we have orthopedics, and we do have orthopedics, we have obstetrics and gynecology, we have pediatrics, and we have ophthalmology. Yes, mostly ophthalmology. So mostly these are the rotations that we go through. And then we have a 6-week external rotation outside the country. We have faculties both in the US and in the UK. And so some of the time we go there to sort of buttress what we are doing here in Ghana. There's a collaborative thing that Ghana College has with the Royal College of Emergency Medicine. So that also happens. Typically in the program, for what your schedule looks like in the program is very, very flexible, in my opinion, because it's a shift system. So we don't have a system where you come to work and work the whole day. It doesn't really work like that. So it's a shift system. So either you're doing a 6-hour shift or you're doing a 12-hour shift, depending on where you are. So you would either be doing a 6-hour or 12-hour shift. Typically UGMC 12-hour shifts, Kolebu either 6 or 12-hour shifts. And typically you'll be working about 3 times in the week. In total, you work in a total, if you're doing 12-hour shifts, you work about 15 times in the month, 11 times in the month technically, with 4 days for lectures. So for these lectures, typically happens on Tuesdays. So we have lectures, we have simulations, which are pretty extensive. We have virtual and we have in-person simulations. And even before you start the program, there is also a boot camp that people don't know about. I think that's some of the things that some of our new residents missed before starting this program. So just like the surgical disciplines, right before you start, there's a boot camp where you are taken through a whole lot of things to understand how the emergency works, because we can understand the sharp contrast with what we assume as emergency, medicine practice than entering into the specialty training, which is a way too different. So we have a bit of a boot camp, and also we sort of empower you with skill and knowledge every Tuesday with lectures. I would say that the challenges that may come with emergency medicine is it's patient based, so and just like maybe any other residency program, it's more of self-empowerment and putting yourself in the right place at the right time. Another challenging thing is you are required to see a number of patients. It's not typical just about the number of years. Yes, you may do the 3 years, but it's also important that you see a number of patients within that 3 years to be able to qualify to sit for your exam. And that sometimes can become a bit challenging looking at the endemic congestions in our emergency most of the time. So, but it just means that if you have been given some number of hours to work in a particular month, it may have to be altered one way or the other. But eventually, you still be able to see the number of patients. And like I mentioned, it's more being available at the right time, because there are some things that you may never see, there are some things that you will see. And then after picking the scale and everything, because we do a lot of simulations, you shouldn't have any problem on that front. But that's it's a different kind of thing that the emergency physician possesses. And that kind of skill can only be gotten like with a lot of time spent in the ED. And unfortunately, you may not be available when that kind of thing comes. And then you may never have that kind of experience. So those are just the few things that you may encounter. The other thing is having to have other people appreciate what emergency medicine is about. I mean, that it's not just in this country, it's everywhere in the world. So people are still yet to understand what emergency medicine means. And so it makes the job a bit difficult. And I know that there are some people who are also worried about what other subspecialties to do, but I think I've already mentioned some of them. So you can think around it and then see which one fits for you, maybe in the long term, in the long term, mostly, yes. I think that mostly we've touched base with most things that are important in this regard. The final advice will be that for emergency medicine, I think I've already even said that you need to be available. You need to make yourself available to learn. And you realize that when you enter the emergency medicine program, you realize that emergency medicine is not about doing things fast and adrenaline. I mean, if you're being honest, anybody else who's not in emergency medicine who has been to the emergency probably wouldn't see all that is imagined, in the movie and all that. It's a lot of cerebral stuff. There's a lot of skill-based stuff, a lot of emotions, and a lot of being able to adapt in a particular situation and all of that. But it's nothing that is beyond any of us, because it's what we were made for mostly. So I think that would encompass almost everything that we need to talk about. In the meantime, I'm available for any questions also at this point. Yeah, and also for the materials for the primaries, yeah, they are always available, especially for those who just wrote. You can always get those materials from them, but we can also make them available, so you can be able to get them or get hands on them. Yeah, I think this is where I'll bring it to an end. Thank you very much.
Thank you so much, Dr. Adomako, for that empowerment. Well, I would have said Tuesday, but unfortunately it's Saturday. So thank you for sharing those details on emergency medicine. Please kindly note that we will have a session for questions and answers. So if you have burning questions, kindly note them down, and we will give you the opportunity to ask them. Right. So moving on, we have public health. It is an area that they say people who don't want to really do clinical work are running away to, but I'm sure that we will have a lot of exposition on that. And so to tell us about residency in public health, I'd like to welcome Dr. Aisha Kadiri English, who is a resident public health from Salvation Army Health Services. So, Doc.
Hi, good evening, everyone. So my name is Aisha Kadiri English. I'm a public health physician specialist. So I'm going to take you through the roadmap to public health residency program. I had my public health residency training with the Ghana College of Physicians and Surgeons. So what I'm going to share with you is going to be basically for the Ghana College of Physicians and Surgeons, but then the West African College also runs, I wouldn't say a similar program, but it's known as the community health. So for the outline for this presentation, I'm going to take us through the core functions of public health, job opportunities available in the world of public health, the registration and interview process, available facilities for the training, the structure of the residency program, workload, lifestyle, and then some challenges, as well as the final advice. So as a public health physician, we are supposed to do mainly three things. We have the assessment, policy development, and then assurance. So when with policy development, we are supposed to help in developing the policies, make sure that there's enforcement, to mobilize community partnership, and then to also inform, empower, and then educate. Then in terms of assessment, we are supposed to help monitor health, and then to also diagnose and investigate, to help in the prevention of outbreaks, epidemics, and then pandemics. Then when it comes to assurance, we are supposed to ensure that we have the competent workforce, and then to also link and ensure everyone has access to quality and then equitable healthcare services. The job opportunities available. Please, can you move to the next slide? Okay, so the job opportunities, you can have the job opportunities within, under the Ghana, under the Ministry of Health. The Ministry of Health, there are so many agencies under the Ministry of Health. We have the Ghana Health Service, we have the Christian Health Association of Ghana, there's the NHIE. Then we have the Ghana Health Service mainly. So under the Ghana Health Service, you could be with the Policy Development Division. You could be a district or regional health director. You could be an epidemiologist, an occupational health and safety therapist. Then you could also go into research. Then as a public health person, you can work with the local and then international NGOs. For the Ghana College of Physicians and Surgeons, a Master of Public Health is a prerequisite. So before you want to register for the program, you need to ensure that you have an MPH. There's, however, no primary examination. So in March, when the registration is ongoing for primary examination for the Ghana College, there's no primary examination for public health. Then when the portal is open for you to actually register for the residency program itself, that's when you apply. And the public health is under the physicians, it's under the physician division. Prior to 2022, like our moderator said, people usually run away to public health when it's ascertained that if you want to run away from the clinical work, then you go into public health. So it was more like people just go into it, just pass, and then they become members. However, from 2022, an entrance exam was introduced. So this entrance examination basically covers all that is taught during the MPH program. So before you go for that entrance exam, you need to make sure that you go through all your slides. So after the MPH, make sure that you have your slides or your exercise books or your notebooks you keep them safely, because you actually need them for the entrance exam. So once you've passed that entrance exam, then you move on to the next step. That's the selection interview. And then this is quite a tough one, because nowadays more people are actually going into public health. I know last year 50 people applied, but only 25 people were selected, because they actually want the best. So the selection process is quite rigorous. It depends on the panel that you are. I think the panel that you go to, I think for my time, I had the NICE panel. So they basically asked me to introduce myself, why public health, and based on that, the questions followed. But then the other panel, they were not so nice. So before you go, I hear now they are not nice, like both panels aren't nice. So before you actually go for the selection interview, make sure that everything you have thought during your MPH, you revise them very well. And then you also know some bits about work at the district level, as well as work within, as well as work generally as a public health physician in Ghana. So that's really about the selection interview. So once you pass the selection interview, you are going to receive a notification in your email that you passed, and then you're going to start your program. The available facilities. Like I said earlier, we have the Ghana College of Physicians and Surgeons and the West African College of Physicians and Surgeons. For the West African College, I know an MPH is not a prerequisite. With the West African College, you can apply to write the primary exam. When you pass, then you just go ahead and then you start the residency program. But then if you have an MPH, you can use that to apply for a waiver to be exempted from the primary exam, and then you can start the program. And I think with the West African College is actually, I think, 18 months when you have the MPH, and then it's 2 years when you don't have the MPH. But the Ghana College is 2 years with the MPH. With the Ghana College, the training, it's a combination of lectures and then field rotations. The lectures are basically held at most of the lectures we had were at the Ghana College at the Ghana College. There are lecture rooms, so that's where we had our lectures. And then aside the in-person, we also had some virtual lectures based on the availability of a resource person or the lecturer. And then we also had some lectures at the National Public Health Reference Lab, some of the lectures at the Public Health Division of the Ghana Health Service, as well as the Kotoka International Airport during our port health rotation. Then we also had some lectures at the National Malaria Elimination Program. With the structure, like I mentioned earlier, it's a 2-year program. All the residents go through so you can move on to the next year. So it's a 2-year program. All residents go through the 4 major subspecialties, including research methods. Then it's a combination of fieldwork and then the lectures. So the whole 4 years is divided into 4 main blocks. So after each block, you'd go to the field for your fieldwork. The fieldwork, you are going to be attached to a district. And then for that particular district, the district health director has to be a member or a fellow of the Ghana College to be able to guide you, on how to achieve your required outputs, because these outputs contribute a significant quota to the final examination and can actually determine if you are going to graduate or not. For the public health residency program, we didn't have any mock exam. There was just one major exam at the end of the 2-year program. So the exam was in 4 parts: the written exam, the MCQs, we had the Viva, and then the OSCE. Things are changing. The exam is gradually becoming more difficult. Gone were the days where everyone who went through the residency training program passed. Now the pass rate is actually declining. I think it's just my year group, that's last year, that we had 100% pass because we actually applied ourselves. People are taking advantage of the flexibility of the program to try and escape. So now, aside the exam, the field work, class, attendance is also required. If you want to actually graduate, you need to make sure that you have at least close to 100% attendance. It's very, very flexible due to the structure, because we had a combination of virtual, and then we also had in-person lectures. Because of I think the way it's structured, the difficulty will be that we don't have other facilities like the other programs. Other programs, there's going to be one at Konfanochi, there's Kolebo and all of that. But then with the public health residency program, everything is done in Accra. It's only when you have to go for your field rotation that you can actually opt to go outside Accra. And then I also mentioned the declining pass rates. But then other than that, the public health rotation, the public health program was actually an eye-opener for me personally. let me just say something briefly. For my journey, I actually didn't register for public health. I don't know. I think I was in that situation where I just didn't know what to register for. Because I think I found myself working at the OPD for like close to 3 years in a community hospital. So I just didn't know what to do. I applied for I wrote the entrance the primary examination for a different program. When the portal was opened, I actually applied for that particular residency program. And then there was this organization that's, I think the GMA, they organized a session for public health specialists to actually come and talk. And then after that, I realized that this is actually what I wanted. So then I had to go back to the college, go and speak to them, negotiate and all of that. So the portal was actually like open for me specifically to be able to change from what I had earlier selected to public health. And I can actually say with my whole chest that I haven't regretted this decision. It's been an eye-opener. You get to realize so many things that when you sit in the consulting room, you don't get to see. And then my final words is that it's doable. Just make sure that you apply yourself. So many people have done it. It's getting more and more difficult. But then once you apply yourself, you're going to pass. And then the public health space, within the public health space, once you get into it, the final advice I would like to give is try to carve a niche for yourself. Don't do what every other person is doing. Carve a niche for yourself so that you can stand out wherever you are. Thank you.
Thank you. To carve a niche for yourself so that you can stand out wherever you are. Okay, thank you so much for that. Please, again, note we will have a session for your questions, so keep them coming. We are receiving a couple of them. Keep your questions coming, and then we will address them in time. Okay, so we skipped oncology and radiation therapy, and so we'd like to go back there. I'm told that Dr. Connie is on, and so Dr. Connie, the floor is yours.
All right. Hi, everyone. My name is Dr. Maria Connie. I'm a second-year resident of oncology and radiotherapy. I did my medical school in Confanoche, did my first-year house job in Confanoche, second house job at Cape Coast Teaching Hospital. And then when I started my MO-ship, I did it at Confanoche anyways. It was a bit of a struggle then to decide on what to do for my MO-ship because I'd done, the 4 main surgical, pediatrics, internal medicine as well. So as I was looking through, there was public health, there was oncology, there were other subspecialties that I could have chosen. But I think what called me towards oncology and radiotherapy were the relatively flexible hours. We don't do nights, we don't do weekends. And for me, I thought it was great. I was tired of doing nights at that time. So I decided to join. During my first 2 years of MO-ship, it was a beautiful experience. I did it at Confanoche. At that point in time, I think we had a couple of specialists who had graduated. We had a few, I think we had 1 or 2 senior specialists and then only 1 consultant at that time. What I can say for the program, it's a 5-year program. If you look at the schedule, they say 4, they say 5. My contract said 6 years. Honestly, I think it's dependent on where you train and if they think you are ready to finish the exams, write the exams. So that's entirely dependent on them. When it comes to oncology and radiotherapy, it's 2 main specialties that we've combined into one. Elsewhere in other countries, schedule can be, the program can't be. With oncology, we're dealing with cancer and the management of cancer. The oncology tends to deal mostly with medical oncology, which is learning about chemotherapy, administering chemotherapy. Radiotherapy deals with radiation to treat the cancer. So there are two very different things, and hence I think if you look at the syllabus that we have, it goes into the anatomy, the physiology. I think we have a similar schedule with radiology, when it comes to the radiation physics part of it. It's quite a lot to learn, but I'll say working both in Oncology. Currently, I'm doing my residency in Kolebu. But I can say about the two different places is it depends on your personality, where you've worked as well. Coming from somebody who's worked at Confanache for quite a long time, the lecturers there tend to be quite, approachable, down to earth, that sort of thing. With Kolebu, it's a bit more intellectual, it's a bit more strict. I won't say you're not as free with the residents, you're not as free with the specialists there, but I think it all depends on a person-to-person basis and how well you can sort of work your personality with them. Ofanashi tends to have more of it's more lenient in the sense that there are a lot more younger specialists, and so you tend to bring your own ideas, they bring their ideas, you tend to collaborate on the treatment plan for the patient. But with Kolebu, you have a hierarchy where you have to see your specialist or your consultant to discuss on cases. And so in that sense, it tends to be a bit more intensive in that way. The difference I would say with the two, once again, Confanache, I know they tend to teach a bit more, especially with the specialists, they tend to teach you a bit more when it comes to the anatomy, the physiology aspect of things, plus radiation physics part of it as well. With Kolebu, we tend to have a general meeting every Monday where we discuss the cases that we've planned. We go over if the plan is okay. So thereby some questions do come up, and you are tested on the spot. It tends to be a bit intimidating to some. I would say take it in your best interest as a point to learn. So with oncology and radiotherapy, we work Monday to Fridays. The clinics are usually scheduled based on the cancer cases that you'll be seeing. Monday tends to be breast cases. Tuesday tends to be gynecology cases, so mostly cervical cancer cases. Wednesday tends to be head and neck. Thursday is prostate cases or genitourinary cases. Friday tends to be more of the colorectal cases and the sarcomas and more of the unusual sorts of cancers that we have. The schedule for both places are a bit different, but I think essentially the clinic runs about the same from Monday to Friday. Work usually starts at 9. You're expected to close by 5, but depending on what you're doing, you might have to be there a bit earlier or stay a bit later, depending on the cases that you have. If you have cases that you need to plan for their radiotherapy, you have to be there for a bit longer to make sure that everything is done before then. You're also expected to be on duty at some point during the week. With Kolebu, it's maybe once or twice a month, 1 day or two days out of the month. With Confanache, I think because of their limited staff, usually the residents will run duties throughout the week. So you pick one resident to run a week duty. The more people who join in, I think the easier the workload is. I won't advise you to join oncology if you think that, it's just because it's a Monday to Friday, it's going to be relatively easier. I would say the workload it's quite intense for the hours that you are there. You're expected to read, especially on your own. And you don't get that much guidance, but we do have the morning clinic, as I said, and whenever you're going to discuss cases with your specialist or with your consultant, you're most likely bound to ask you questions. So that sort of thing does come up. So in that case, you are learning directly or indirectly as well. Yes, and then we also do journal club or a sort of presentation every Wednesday. So usually they pick a topic for the week. We discuss maybe the anatomy of the breast cancer, the types of breast cancer that we have, the treatment modalities. We go into journals just to see what the upcoming trends for treatment is. The way oncology and radiotherapy works, what works one day, in the next 6 months, a new publication might come up, and then you have to change your treatment course or your treatment outline depending on what information makes more sense at that point in time. The anatomy and physiology will always remain the same. Physics will always remain the same. The treatment modalities may change somewhat, but usually it's not a very drastic difference from what you've learned. When it comes to the membership, once you apply, you write your primaries, you start the residency. Usually by the second year or the end of the second year, you're entitled to write your Part 1 membership if your director or head of department deems you fit to write. The membership, usually we write the Part 1 first. That's after the second year of residency. And the Part 1 exam usually entails anatomy, the physiology. We do statistics as well as the radiation physics, and then the pathophysiology. So you do have to learn a bit of pathology. You have to know your anatomy from head to toe, especially when it comes to the lymph node stations, the routes that the cancer can spread. It can be a bit extensive. It's quite a new topic because it's not something that we were necessarily taught in medical school. But I think once you have the interest for it, it's quite rewarding. People have this perception that if you join, it's going to be mentally draining because you're dealing with sick people. But I'll tell you that our patients are usually one of the strongest people that you would ever meet. And they're also long-term patients. They're usually with you for life until they die or until, they're cured for quite a long period of time. And we tend to discharge them from the clinic, which does happen. I don't want people to think that oncology is just treating, palliative cases and everybody who comes to us is sort of on their deathbed. It doesn't happen like that. We have quite a number of cases who are, quite advanced or they are metastatic, and so we treat them with palliative intent. But a good number of patients that we do get are early to, I would say, a little bit advanced. And we encourage a lot of them that it's not a death sentence. Once you do your treatments, usually recurrences tend to occur less frequently, and most people are okay, and we tend to discharge them from clinic. I don't know if there's anything you guys want to talk about. You can put in the section for the chats. I'm free to answer any questions. If there's anything I've left out, do let me know.
Thank you very much, Dr. Connie, for that presentation. Right, so we've been through loads of presentations. We have one very last one, which is on pediatrics. So to talk to us about pediatrics, we have Dr. Nana Ama Ajiman, who's a pediatrician at the Achimota Hospital, and she completed her residency last year. So Dr. Nana Ama, please, you can go ahead.
Okay, good evening, everyone. Nita, can you confirm if you can hear me? I'm having a few network issues because of the rain.
We can hear you very clearly.
All right, so thank you for saving the best for last. This is pediatrics, and the residency pathway is demanding, but again, I'll say it's achievable if it's something you want to do and you love, because we have the honor of being advocates for people who can speak for themselves, and you have to take everything into your hands to cater for them. So it's very privileging to be in that position. Again, most people think, especially in Kolebu, alluding to what Maria was saying, it seems Confanoche is a bit more relaxed generally. But I would say that with pedics, from the outside, it looks as if it's tough, or it's it's a very hard zone, but it's not. When you come into pedics, you realize that every single one of them is willing to help you and hold your hand through. And I'd say that I think the pediatrics program under the Ghana College is one of the best, because there are mentors every step of the way to guide you, unless you don't want them to help, but they're available. And so I'd entreat everyone to, utilize them when they come into the program. So I think, as others have said, we've got West Africa and then we've got Ghana College. In pedics currently, we train at Kolebu, Confanoche, Ridge, and 37 Military Hospital. And the exam, as we've said, is run for Ghana College between March, and then the second one in August, September. And then, West Africa also has their calendar, which typically is around February and then March. Most of us in the child health department tend to do both colleges, because really the information is quite similar. There's just a few differences. And I think for me, having done both, it's getting two for the price of one, really. It's a 3-year program with Ghana College, but a 2-year program with West Africa. But oftentimes you would, right at the end of the 3 years, so that you just do both and then you're out of the system. But there's still the option to go ahead and write your West Africa once you qualify for it, and then stay on another year to do the Ghana College. Again, particularly I'll speak for, nursing mothers, or most of the women, females who've had to pause in the career path because of delivery, having children. You can always write, there's room, the 6-month extension. So you come back, as a plus, R3 plus, and then you can write your exam. But because of that, some people would end up writing the West Africa prior to the Ghana College. So there's all that permutation, which you're allowed to do when you come into the program. For most of the females, I advise that you talk to your mentors or your senior colleagues and find out what will work best for you. Residency in pedics is flexible in the sense that you would be required to do a lot of rotations in the 3-year gap, but it's well structured. So right when you come in the first year, you know which blocks you're doing. And then the second year, you're told the blocks you're doing as well. And then in the final year, you get your last blocks, and then you get some break and prepare for the exam. During this time, you have your senior colleagues prepare you appropriately, taking you through simulation exercises. But again, remember that this is adult-led learning. And so everything that you will do, you would sort of have to initiate it. As much as they're willing, let's remember they're also busy. So you have to initiate it. And once they see you're interested, they will help you through the journey. It's been a rewarding, journey. I'll say that, of course, there have been challenges, and the system is not perfect. It has its loopholes. Pedics is demanding in the sense that you really have to be the one asking all the right questions to find out exactly what is wrong with this child you've been presented with, unlike adults who are at liberty to tell you everything themselves. And so people think that pedics is hard, but it is not. And I would encourage that you should be passionate about it before you get into it, because it's not a walk in the park. It's demanding in the sense that you have to think for that child, and you have to direct them in the right, way, so that they can better appreciate where you're coming from. So the parents give you the right information that you need to make the diagnosis. There's a lot of advocacy work when it comes to pedics. There's a lot of money that goes into it, in the sense of soliciting for funds for your patients. It's not compulsory, but it just comes with the work and the passion. You'd realize that as you serve them, as you want them to get better, if a child comes and they don't have the funds, you're moved to want to help. And so sometimes you would come with a full wallet, but you go home with an empty one. But it's all part of the rewarding and satisfaction that we get from them. So basically, this is Pediatrics for you. I'm simplifying. I don't want to scare anyone, but do come on board because we need a lot more pediatricians in the system to be able to cater for our young ones. And I'll be on standby for any questions if anyone has. Yeah, Nita, thank you. Over to you.
Thank you so much there for that. We'll be taking the questions very soon. I think we have the very first question, which is okay. How do you start residency right? Okay, so imagine you are a house officer, you're done. You have written your primaries, you've passed, but then you're yet to be posted. So the question is, where do you get sponsorship from? I don't know which of our speakers would want to speak to this.
I'll take it since I spared you a lot of time. Well, so with
right, thank you.
sponsorship, it depends on the facility you're coming from. So if you're in the government agency, Ghana Health Service, there's an application that's open for study leave and you apply for this. And then once you're granted, usually there's a requirement. So if it's not a residency program that is in high demand, I mean, where the ones that have less people applying for, then you'd have to work for about 3 years before you get into the program. However, if not, and it's a straight program, you can apply through your hospital into the Ghana Health Service, and then they grant you the study leave. And then government will pay, once you're granted study leave, it means that government is taking care of your the school fees in codes. But if you are coming from a private institution, then you would have to figure out your funding yourself. And so you have to speak to companies, family to support you with the payment of your fees. I don't know if that helps.
I'm sure that helps very much. Thank you so much for that. So we are still taking questions. We have quite a number. We have a question from Lucy Fafa. I'm sure this is from YouTube. And the question is, how expensive is residency? That's the first one. And the second one is the College of Ghana the same as the West African College? That they are not, I can say that, but the person wants to know what are the differences? What are the differences?
I don't like to call me seriously.
Could you kindly mute if you are not?
Okay, so let me try and see if I can answer this.
Okay, sure.
So with the Ghana College of Physicians and Surgeons, it isn't the same as the West African College. So a certificate from the Ghana College of Physicians and Surgeons allows you to practice within Ghana only. But then with the West African College of Physicians and Surgeons, there are a number of West African countries that you could practice using that particular certificate. But then it's also country specific. So when you can practice in Nigeria, but then you need the license in Nigeria before you be able to practice, even though you have the certificate. So about the cost, once you are sponsored by the government, you are not going to pay any fees. You are going to get your salary. So it's like it's more of like, that's why it's called residency in training, like you are a resident. So you are going to be paid your usual salary. And then based on when you are due for promotion at work, you'd go for your promotion interview, you end up with your promotion. So it's not that expensive unless you are the one paying So if you are paying, that means that you are the one going to pay your fees. And it also depends if you are going to continue working at your facility to be able to get your salary or not. So that's why it's advisable for you to get your study leave before you start your residency program. Thank you.
Hello, sorry. Oh, I was speaking and I realized I was muted. So sorry about that. Okay, so this question is from the chat and it's for residency in general. Do you pay tuition fees or do they just give you a salary? And also, what is the average salary for the first year residents of any specialty? And does this increase with each year?
Okay, Nita. So I was responding by text, but I think so you don't pay the tuition fee yourself if you have been sponsored by an agency. But if you are going as an individual, let's say you're in a private facility or you've been out of work and then you're coming back to do residency, then that tuition fee is borne by yourself. So the institution sort of pays directly to the college, Ghana College. So you have no business when it comes to like school fees is due and then you have to go and pay. Usually they will pay directly to them. So for the 3 years, 4 years you're in the program, you have no business with how your school fees are paid. All you know is that it's being paid till you finish the program. We are not paid. I mean, you get a salary, but your salary is not because you're doing residency. Your salary is because you're still a practicing doctor. So whatever grade you were at the time you were applying for residency, so say you were a senior medical officer or a medical officer, whatever salary you were getting then is what continues up until you finish the program. And then when you finish the program, you are upgraded. And so you become a specialist and then you start getting your specialist salary. Does it increase each year? Was that with reference to the salary or the tuition? If it's the tuition, it's subject to the college. So depending on what Ghana College or West Africa College says is the tuition fee for that year, that is what it is. But in terms of your salary is going to increase based on your grade. If your grade points are going up, then as controller has been paying you or whatever institution you are under, whatever they pay you is what holds. Hope that is clear.
Crystal, thank you so much.
Residents are not paid because of residency. They are paid because they are practicing doctors. So they are paid for their grade. Yeah.
Yes, thank you so much for that. Okay, so our next question, this would be to, well, no one in particular, but the question is, another presenter mentioned $1,000 fee for enrolling on one specialty, if I heard right. So after enrolling in the school, whether West Africa or Ghana College, I think we've already spoken about the fees bit, but this question is for clarification on the $1,000 that you need to pay in addition to for the waiver, I think, if I'm right.
So I mentioned this, and the waiver, as mentioned by the others, comes with a fee. That for psychiatry, that I know is $1,000. I think it may be across board, just that people know that there's a waiver to be paid. So you pay that and then you enroll without thinking about fees. Thank you.
Thank you very much. Thank you very much for that. Okay, so I think there were quite some more questions about salary, but I think we've clarified that. Okay, so this is for emergency medicine and from Everlasting Ministries. What are the subspecialties under emergency medicine? I think a few were mentioned. So I think that question is answered, unless you would want a more exhaustive list. So, Dr. Adomako, is there a more exhaustive list? I think you mentioned about 2 or 3.
Yes, mainly 2, but a third one which is yet to roll out. Yes, but mainly sort of general emergency medicine, critical care medicine. Yeah, and the third one I mentioned was the pediatric emergency medicine, which is a program that's being done by both the pediatric faculty and then the emergency medicine faculty. Yeah.
Okay. All right. So far, those are the questions that we have. I don't know if there are any additional questions from. Okay, we do have a few more questions. Okay, so this question is from Thompson. Thompson wants to know, do you get leave as a resident and how many days? Do you get leave as a resident and how many days? And this is to any of the speakers.
Yes.
So I realize that it differs across faculties. I'm not so sure, but with emergency medicine, it's mostly a month in a year. And for Accra emergency medicine, mostly it's a pre-scheduled leave period, but it can always be altered depending on what the schedule looks like for every person else. But it's mostly just 1 month, like the whole month, the full month, not like working days. Yeah, mostly so.
Okay, so
Yeah,
you
I'll
get
speak for ophthalmology. I think it's as Eugene said, it's based on where you are. So for us currently, our leave for residents is 24 working days in the year. So you can divide it however you want, but it's 24 working days for the year. Yeah.
okay. Please, for any of the other specialties, is it different? And if it's different, could you kindly share?
Okay, so for psychiatry, you also have a month. So weekends inclusive, 30 days. That's just for the year.
Okay, and family medicine?
Also for family medicine, we have a month of leave, including holidays and excluding how do you call it, weekends. Yeah.
Okay. Radiology? Oh, wait. Oncology and radiation therapy, rather. Different. Yes.
Yeah, so with us, we do 36 working days, but you would have to divide it within the year. So you do 18 working days within the first 6 months, and then 18 working days for the next 6 months. There's usually a schedule. So you would have usually the specialists and the senior residents tend to have, the pick. So usually it will depend on the time that is given to you, but sometimes you're free to make your own internal arrangements with the residents as to the time you want to leave.
Okay. All right. I think we have public health.
Okay, so for public health, there's no leave, but however, you can have an internal arrangement if there's an emergency or your course coordinator. The course is quite flexible, so you have a lot of free time to be able to do other things. So you don't really need the leave. But then when it's an emergency, you can just speak to the course coordinator and then you'll be sorted out.
Very good you clarify that. Saying there was no leave, I'm sure that gave a couple of people palpitations, but thank you for clarifying that. Okay. And then for pediatrics, we've already
No,
yeah.
Pediatrics has 26 working days. I think we're similar to as Maria said. It depends on where you are, but in Accra, that's Kolebu, you're allowed to divide it into two. So 18 in the first half of the year and then 18 in the latter half, just to accommodate everybody.
Okay, then. He's still on pedics, and there's a question that says that I hear not all hospitals allow for West Africa College in pedics. So which hospitals can you get trained for the West Africa College in?
Okay, so currently I would have to cross-check because at the time we were writing, it was mainly Kolebu, Confanoche. 37 is, if I'm not mistaken, 37 is not accredited for West Africa. Yeah, so for now, I think it's just Kolebu and Confanoche that I'm sure about.
Okay. All right. So I think this is to any of our panelists today. What do you do if after the selection interview you are posted to a facility that does not support whether it's does not support both West Africa and Ghana College? What do you do?
Well, typically, I don't think you'll be sent to a facility that does not have the program. I mean, you may be sent to another facility that runs the same program, which is a facility of your choice, but you won't be sent somewhere where the program is not run. But I know that you can still write to the academic chair or so, who would now liaise with your faculty chair, because sometimes the faculty has reasons for redistributing you to, or redistributing residents to different places in terms of patient load and all that. So I think sometimes with good reasons to the faculty chair or to the rector, some of these things are considered, but it's not cut in stone. It may not be considered either. It's depending on the reason.
Okay, so I think if I understand, they are asking like being sent to a particular facility, like with PDX, maybe you end up at 37, so you're limited. You want to do you be made to do just Ghana College instead of Ghana College in West Africa. Is that right, Nita?
Yes, I think that's the person's question. If
So
the facility limits you in any way.
yeah, so I think like Eugene was trying to say, there's a room for writing to them, but it will depend on the numbers. So I would advise that like in the application, try and be early. If you know you want to do both, go for the schools that are training for the hospitals that are training for both. But if you don't get that, I wouldn't say I mean, you never know. I know people who didn't get the chance to write both, and it was actually a blessing in disguise for them. So, I mean, big deal. You can always decide to do it at a later time or not at all. It's really not, it's nice to have the two in one, but if you don't get it, you still have certification for being a specialist. It's not that big a deal. Yeah.
So sorry there. My internet just messed me up, so I dropped off a bit. Okay, so we have specific questions for some more questions here. This is from Lydia and Kansa, and she wants to know, you have been posted, so you haven't been posted, so you don't have a facility. How do you start residency? You haven't been posted yet, and so you do not have a facility. How do you start residency?
So you're not attached to a facility. I mean, you finished house job, but you're not yet an MO, or you've not started practicing as an MO. Is that the question? Is that the angle she's coming from?
I believe so.
Then in that case, you're on your own. I mean, you'd have to pay, you can apply. There's no limit to how you apply because you're an individual, you're a doctor, so you qualify. But then it means you'd have to pay your tuition. You don't have an agency to sponsor you because you're not covered by any agency because you've not been employed. But you are at liberty to apply for the residency program either through Ghana College or West Africa, and you pay the tuition yourself.
Okay. Right. Okay, so someone wants to know. Okay, yes, please, you can go ahead.
Okay, so I would like to say that for those of us with in deprived areas where people are allowed to write, I mean, the primaries when they are doing the house job or doing the first year of MO-ship, I think it would be imperative that you can decide to write and wait for your postings to come, because usually in your application they ask for the facility you belong. I think there's that thing to be filled. So I'd rather you posted, then immediately you receive an what they call that letter, a posting letter. Now you can actually begin the process because you've already written the primaries and you've passed. It's better so that you know you are cushioned from paying the tuition fees. There's no rush. The thing is, you can write the primaries and wait. Get an report to HR. HR, let the HR know that you are going in for whatever program you've applied to, and then let them process whatever can be processed for your leave, and then you proceed for the program rather than apply. Well, if you have the money to, okay, that's fine. You can do that.
Well, that leaves it. If you have the money, then that's fine. Okay. But it's preferred that you go for your posting or write and wait to be posted. So that at least you have that facility support. Okay. So there's a question that says, can one do West Africa and Ghana College at the same time? I think that has been emphasized several times. It can, just that some of the exams are written at different times. And so you can write one and then write the other. But I don't know if any of our panelists want to speak more to this. And the question continues that also which one really works in our setting? So is it West Africa or is it Ghana College for Ghana, to be specific? So Dr. Hammond, would you want to speak to this?
Yeah, I think it has been said that you can do both Ghana and then West Africa College. But it's just that so you have to write two different primaries, or you can exercise the waiver option. And then but the clinical work it's practically the same. So that's why Dr. Nanama was saying that you get two for the price of one. So you just go through and then work hard, study, and then at the end you write the exams. The exams, there may be slight differences. So for, as I said, in ophthalmology, the optics exam for the Ghana College, you do it in the second year, then you do the final exam in the third year. But for West Africa, you do the optics exams in this like in your third year when you are writing your final exams. So those are some of the um, subtle differences, but otherwise it's largely the same. Yes. What was the second part of the question?
Which one works best in the Ghana setting? Which one
Oh,
really works?
both of them, yeah, because Ghana is part of West Africa. So if you do West Africa, you can do, I mean, you can practice in Ghana. If you have the Ghana College, you can practice in Ghana. So it's really personal preference.
Okay. Dr. Hammond, while we're on that, would like it if you could kindly drop your contact and email address. In fact, I think if our speakers can be kind enough to drop their email addresses or contact if they're comfortable in the chat for anyone who's willing or would want to reach out to them. I think I heard throughout everybody's presentation that they are willing to support. So if you could
Yeah,
kindly drop your contact and or email address in the chat so that
gladly.
yeah, those who have joined us can.
I'm looking for the future of ophthalmologists.
Yes. I think the future of ophthalmologist is Nana Ikia
And let,
Frimpong.
let me add, there's a lot of money in ophthalmology.
Ah,
Yes.
okay, Dr. Hammond is
Yes.
doing marketing for ophthalmology, so please, there's a lot of money.
Yeah, yes. Both in
Okay,
public, but especially in the private practice as well. So, yeah.
okay. So, someone's question is, can I get into the college with only West Africa? I roll for Pediatrics, so they roll for Pediatrics, and they want to know if they can get into the Ghana college with West Africa. I think yes. So I don't know who would want to speak to this.
Yes, so I stand to be corrected, but I think there's one person who did it that way. So you've written the West Africa and you'd apply for Ghana College, and then you would I think with that pathway, what happens is, so you're primarily no, the other one, that it holds the other way rather. So you can come into the West Africa program. So you are coming through the West Africa College, but you'll be attached to, say, Kolebu. And then when you're done with the 2 years, so you're doing just a 2-year program. However, if you apply and you start and you also want to do Ghana College, you can pay the waiver to Ghana College to get the Ghana College certificate, which is a 3-year program. I hope it's clear. So you've written for West Africa primaries, you've passed. You would apply for the West Africa College of Physicians, and then you come into the program in Kolebu, for example, which is a 2-year program for pediatrics. But whilst you're coming, if you want to do the Ghana College program, then you use your primary to get an exemption for Ghana College at a price, and then you stay in an extra year for the Ghana College program as well. And then you write the Ghana College exam at the end of the 3 years. Yeah.
Okay. Yes. Thank you very much. So unfortunately, my network, because of my network issues, I dropped off, and so I do not have access to the questions that were initially asked in the chat. But I'm sure that our speakers have access to that, and so they can type in some of the responses to some of those questions. I think I have one more question here. One more question. Okay.
Nita, sorry, just to go back on the last question you asked, but I would advise if you're not a Ghanaian, that is fine or easier. But if you're Ghanaian, then you may face some challenges with Ghana College, because then the assumption is, why didn't you do the Ghana College since you are entitled to do that directly? So kindly be sure about what you want before you go into it, so that you're not strapped in the middle. Because if your case is isolated, then it becomes difficult working it out. But if you've already asked and they are okay with that, then you can go ahead. Yeah.
All right. Yes. The final question on my side is, does West Africa College offer oncology and radiotherapy as well? I think the answer is yes, but I will defer to our speaker, Dr. Connie.
Hi, sorry, what was the question?
Does West Africa do oncology and radiation therapy as well?
Yes, they do, but I think here everybody does Ghana College. We don't usually defer to West Africa College for our license anyways. But you're free to do both. It's usually not a problem.
All right. Okay, so that's the end of the questions from my side. I would like to say a very big thank you to our speakers. We have gone through family medicine, ophthalmology, psychiatry, oncology and radiation therapy, emergency medicine, public health, and pediatrics. And to remind us that this is simply day one of the transition residency. This is the pathway to residency and residency unlocked. And so day 2 happens tomorrow. And for the day 2, we are going to look at, I know that there are some people that are asking questions about, I want to know about obstetrics and gynecology. So tomorrow we are looking at general surgery, dental surgery, orthopedic surgery, obstetrics and gynecology, internal medicine, laboratory medicine, neurosurgery, and radiology. And so if you have interest in any of these, or if you just want to hear and get to know, more about the specialties, please tune in tomorrow as well. But we are not done yet. We would like to, I'm sure all of us who tuned in have really been, we've received a lot of insight on the path to residency. We'd like to say a very, 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 very big thank you to Dr. Beecham, Dr. Hammond, Dr. Inchi, Dr. Connie, Dr. Domako, Dr. Kadiri English, and Dr. Ajimang. Thank you so much for your time. Thank you so much for um, explaining things, not holding back, telling us what's really on the ground. And rest assured that a lot of the people on the call and a lot of the people that are joining on YouTube would look for you, will hunt you down, and would request for your support. So a very big thank you. Thank you for all your help. So at this point, I don't know if there's any burning question that has not already been dropped. You can quickly drop it before we move on. But as we've all really been enjoyed this session, and we're thankful for it, because I'm sure in the past there's always some mystery around the process, and Med Transitions has taken upon itself to guide medics through these various transitions, from medical students to house officer to senior house officer, and then to residency. And I'm sure, through the residency to fellowship and all that. And it's not simple. And so we'd like to ask if anyone is open to support the team that has been working. I think it's a brilliant idea. They've been working really well, and so we've put on the flyer. If you'd like to
I don't even
donate
understand.
to
I don't
support
understand.
support
Almost.
the team, you can send your donation to 02405.
Hello, Dr. Netta. Hello, Dr. Netta.
Yes, hello.
Yeah,
Oh my
we
goodness, I have been on
couldn't
mute.
hear you.
Oh,
I wanted to be sure.
oh wow. For how long has that been going on? Anyway, yes, so we would like to seek your support. This has been handled by the team only for so long, and if there's any way you'd like to support the team, you can send your donations to 02405266667. You can always support the cause. It's been great. If you have in any way been enlightened by this and you think it's a good cause, I think putting your money to support it is a great thing. And so the number will be on for a while. And yes, please do well to reference when you send anything, kindly reference it med transitions, as we help the medics, ourselves and the ones to come transition from from medical school to house job to residency and upward. All right. So at this point, we'd like to take the closing remarks, and to give us that, we'd like to welcome Gideon Ofori Darko to give us the closing remarks.
Okay, thank you very much. All right, so we would like to thank, I think this program has really been an insightful one. This session has been a very wonderful program. I've learned a lot of things myself, and would like to use this opportunity to, first of all, thank the Almighty God for making it a successful session. We'd also like to thank MedTransition and then the Ghana Association of Doctors in Residency for coming together to put such a wonderful program out there for the many of us, for the perspectives who are yet to write the primaries, those who have also written the primaries and are yet to apply into the various colleges. We also want to say a special thank you to our wonderful speakers from the various specialties and the many things they've shared with us today. And a special thank you also goes to our wonderful moderator, Dr. Netta Pasram, for moderating this session. I think there's one last thing I would like to say. One takeaway that I got from the session was a statement that was made by the first speaker when she said that the journey is what we make it. And so I'd like to entreat all of us that as we go through the various sessions, I know there are a lot of things that will drive our decision. For some, it may be due to family reasons. For some, it's an ambition. For some, it probably is the flexibility of the various specialties. But then at the end of it all, the journey is what we personally make it. And so as she shared with us, we have to be diligent, be committed, and also put to practice. There are a lot of mentors also out there. And so this journey can be taken with help. It's not one that we necessarily have to struggle. So lastly, I would just like to thank each and everyone who also joined this session, and we hope that tomorrow we'll also have you on board as we continue. Thank you once again.
Thank you so much. Thank you. Thank you. So, like we just had, we'd like to say a very big thank you to all of our speakers. We've gone through family medicine, ophthalmology, psychiatry, oncology and radiation therapy, emergency medicine, public health, pediatrics. And it's been incredible. We'd like to say thank you to Dr. Beecham, Dr. Hammond, Dr. Inchi Kuranting, Dr. Connie, Dr. Domako, Dr. Kadiri English, and Dr. Ajimang. Thank you so, so, so much. We appreciate your time. Be sure, we certainly know that people will hunt you down, and we are thankful that in advance that you are willing to help us. This is just to let us note that tomorrow it continues, and tomorrow we are going to look at, I know there are some people that are asking about other specialties. Tomorrow we are digging in. We're going to general surgery, dental surgery, orthopedic surgery, obstetrics and gynecology, internal medicine, laboratory medicine, neurosurgery, and radiology. So if any of these tickle your fancy, please make it a point to join us tomorrow. If they don't, but you are just curious, you're still welcome to join us. It's going to be wonderful, wonderful time. Okay, so the last announcement, we will have a feedback form that will appear when the session ends. And we will really appreciate it if you could fill it. As you can see, this is something that we hope to continue over the years. And so your feedback is very helpful so that it can shape how we go about the future sessions. And so thanks so much. Thanks so much for joining us. We are so, so, so grateful. And we will like to take the closing prayer from Dr. Esther Ajikum. Dr. Esther, if you're here, thank you so, so much. Would you take the closing prayer?
Okay, thank you, Dr. Netta. Please, we are praying. So, Father, we thank you for today. We thank you for such a gathering as this. We thank you that much more than hearing, we have received the ability to do these words. That we are not living here with just theoretical knowledge, but we are living here with the ability. We are living here with a mind to do these words. And we thank you that tomorrow is much more impactful, much more insightful, and much more bigger than what we expect. Thank you, Lord Jesus, for an answered prayer. In Jesus' name, amen.
Amen. Amen. Please
Amen.
remember to donate. Thanks our speakers and thanks for everyone who joined us. See you tomorrow and please fill the form. Thank you.